share. Anybody knows how to share the screen? I am trying, but it is not showing. Chrome application, entire screen, share. Why? Students, anybody from you have any idea how to share the? Because this my system is not sharing, although it is showing that it shares, but I don't think you see anything.
No, doctor.
No.
No, doctor.
You see nothing, right? Anybody knows how to share the screen? I mean, it's showing me the options of sharing, but it's not showing. Maybe I have missed in step or something. Do you see anything now?
Yes, doctor.
What?
We see WebEx VPK 3251.
Okay, you see it now?
It's still on the same page, doctor.
It's still on the same page. You mean WebEx, is it?
Yeah, WebEx.
Okay, hold on.
Doctor, when you are sharing the content, there'll be an option of screens. You can choose your lecture note from there, like Microsoft PowerPoint and so on.
Okay, hold on. Let me go to the. Okay, now tell me, what do you think when I share? Okay.
When you click share content, there would be options Google Chrome, PowerPoint, or the lecture note.
Yes, that's what I am doing also.
Try clicking on the PowerPoint.
Okay. Actually, I have done that exactly what you just now say, but still I don't know what it was not showing. Let me try again. Okay. When I click, it is showing two options, screen and application, correct?
Yes.
So when I click screen, you mean screen?
Not screen applications like
Okay, I screen. Okay, now it's showing share your screen, then your entire screen, application window, and Chrome tab. Is it? No.
no.
Okay, then I go to another one. Okay, I click screen. Cancel. Okay, I share. I click application. Is it still showing the same? Both are showing same. Application window. Okay, when I click application window, it is showing me the icon of meeting in progress and FaceTime, and then there is one Chrome tab. There is no option of the PowerPoint. It must show the option of PowerPoint, is it?
Yes, doctor, you can see the option of the other application that you have opened.
Okay. Or then what I am thinking, I have to make a new link and then start again. Sorry guys, sorry. This is not first time I'm using this one, but this is first time making problem.
Doctor, do you want me to help you to like share the content?
Sorry?
Do you want me to help you to share the content?
Yes, I can. That's also a good idea. So I email you, right?
Yes, doctor. Is this the lecture, doctor?
Wait. Draft, no.
No, okay.
Do you have the lecture like sedative opioids and sedative opioids and neuroleptin analgesic?
No, doctor.
You don't have, huh?
No, doctor.
Mm-hmm. Okay, let me try last time, eh? Screen, share, application, Chrome tab. No, it's not showing actually PowerPoint anywhere. Okay, let me email you. Then you share with it. Then I have to lecture. That's the only option I have. Class rep.
Yes, doctor.
Okay, send me your email.
I'll WhatsApp you, doctor. Or do I need to type it in the chat box?
Mm-hmm.
Do you want me to WhatsApp you my
Yeah,
email
yeah,
or?
yeah. Anyway, just give me now so that I can share with you. Have you shared already?
Yes, doctor.
Okay, I'll send you now. Okay, Namalan, sent already. Check your email. Did you receive? Namalan? I can't hear anything.
Dr. Anthony checking his email.
Namalan, unmute your speaker. Unmute your speaker.
Yes, Doctor, I've received the slides already.
Okay, share with the screen now. All the students must be bored now.
Okay, sure.
Sorry guys, this is the technology problem.
It's okay, doctor.
It's okay.
Okay, doctor.
Uh,
Okay, so
can
okay,
you see the slides?
yeah, I can see. So can everybody see the slides?
Yes, doctor.
Yes, doctor.
All right, thank you very much, Nimal. And sorry guys for delay. Okay, let's start. So the title of our presentation is actually the sedatives, opioids, and neuroleptalgics. The learning outcome for this subject are list the injectable anesthetic, inhalant anesthetics, and local anesthetics, which are commonly used in veterinary practice. And then to describe the mechanism of action for these anesthetics, and then relate pharmacological characteristics pertinent to practical use. Okay. And these are the resources which which I have referred, and you can also refer these, as well as it's not hard and fast that you can also go to any other references. Internet is open for you. Okay, this is a little bit terminology about the drugs, anticonvulsant effect. of the drugs which depress the motor or central activity, and then we will come across with anticholinergics and during this anesthetic lecture, and these are the drugs which block receptors for acetylcholine, and then we have tranquilizers and sedatives which calm and relax the animal or they produce the state of calmness and relaxation, and then analgesia or the analgesics, the drugs which stop pain sensation, then anesthetics, no sensation, and then hypnotics, the drugs which cause sleep. So before going to our main topic, we will briefly go into a recap. For example, how communication takes place, what are the basic unit of communication. You might have gone through the physiology. Yes, is it? Anybody can tell me how communication takes place? You can speak, unmute speaker if anybody wants to tell me or discuss with me. This will be also a lecture, and along with that will be an interactive discussion also. At the end also there will be questions also, so you are free to talk also. And have any idea what did I ask? Communication, huh? So how communication takes place? Okay, this is how a communication in mammalian brain takes place. So what is a functional unit of a brain? Is neuron. You already know, right? It receives and sends information to and from other unit. Everybody can hear me, is it? Or no?
Okay,
Thank you.
doctor.
Yes.
Okay, all right, that's great. Because I felt that I cannot hear anything, so I thought maybe it's disconnected. Okay, so in case my voice is disrupted, and you cannot hear, you can unmute your speaker and talk, or send a text message in the chat box so that I know, right? Then we can start from where it was disrupted. So this is a basic unit. It's just a recap we are doing it. Basic functional unit of brain is neuron. So all the communication takes place through neurons. They receive the information and send information to another neuron, and they communicate with each other at a specialized junction called synapses. You have all heard of that, synapses, right? Okay, going further. So this communication also takes place through the neurotransmitters. They are the neurotransmitter in mammalian brain, which of course there are many, but I'm focusing here the ones which we will be dealing during our specific part of the anesthesia. Okay, so there are two actually, can be more, but there are major which we will be dealing with. There are two: glutamate neurotransmitters and GABA, gamma aminobutyric acid. So there are two most important neurotransmitters. Glutamate is the excitatory, which increases the probability of postsynaptic firing. Postsynaptic firing, that is when I'm saying postsynaptic firing, that is the action potential. I'm referring to the action potential. Okay, you have already read neurophysiology and neurophysiology. So, and the other ones, they are GABA. So, glutamate, they are excitatory. They increase the probability of postsynaptic firing. That means they increase the action potential or activity of neurons. The activity of neurons increase. Okay, remember the keywords. So, others are the GABA inhibitory. They are the ones very clear from the name GABA inhibitory. They are inhibitory linear action. That means they decrease the probability of postsynaptic firing. That means they decrease, they stop the, or they can slow also the action potential. Okay. Okay, so a given neuron releases one neurotransmitter from its axon at a time, either glutamate or GABA, right? And these two neurons are the ones found in the vast majority in the central nervous system, GABA and glutamate. And among them, glutamate is abundant, that is the 80%, and GABA is only 20%. Okay. That's acetylcholine. Actually, we will not go through it. Actually, I did it. Maybe I have sent the file, which is something big file. Okay, move on, move on, move on, move on, move on. Okay, okay, okay. Hold on, hold on. Go back, go back. Okay, communication. So we are talking on communication, right? So the synapses excitatory, the release glutamate, which is just now I mentioned, 80% of all synapses in mammalian brain are excitatory, and inhibitory GABA, they are 20%. Okay, go further. So the communications, again, the circuits for the sensory information, sensory processing depends on glutamatergic synaptic signals. As a vision, example, just example, vision and then touch. They are the two examples, and all others which are also. So how it takes place, yes, go forward. How it takes place, the sensory processing. When you touch the skin, it goes to the brain stem and then thalamus, somatosensory cortex, right? Then neocortex, which where the generation of the sensory perception of the touch takes place, perception. So vision, I'm focusing the word perception. Later we will discuss this, why I was focusing where the first perception takes place. And then vision, again, when the image or something, eyes look at that, then it goes to retina, and then retinal ganglionic neurons to the thalamus, they further process, and then there's a visual cortex. This is how the flow. So the glutamatergic synaptic transmission is the one that gets sensory information from periphery to neocortex, and where it drives sensory perception. And this is the principle is true for all other senses, like smell. Okay. Okay, now GABAergic neuron release GABA, which most of the inhibition in memory, which actually causes most of the inhibition in the mammalian brain. It's a GABA. So remember, this is GABA and glutamate. They are the two main neurotransmitters playing a role. Okay. Because role in what? When I'm saying playing role, that means you understand that we are talking about anesthesia. Right. Okay. And these account for 20%, which I already mentioned. Okay. Go ahead. Move forward, move forward. This is not related to this. Okay, so GABA versus glutamate. So mechanism actually for action potential both for both glutamate and GABA is same. The machinery is same, but the only difference is that neurotransmitter. Okay, but the mechanism how they are released from the synaptic vesicles and the presynaptic neuron, it is same. Okay. No, go forward. Go forward. This no. Move forward. Okay, we are now coming to a sedative hypnotics. Go ahead. Oh, I think this is really wrong. Go to the sedative anesthetic side. Move forward. Continue moving forward. Okay. Okay. All right. So we are coming to our main topic now. This was a brief recap of few things which definitely will help us in understanding the how the drugs work. So I have uh, refresh your knowledge for the action potential, like then communication, how communication takes place, how the information goes from periphery to central nervous system, and then the most important ways of communication are excitatory glutamate and inhibitory GABAergic neurons. So the sedatives are the drugs which reduce mental activity and cause sleepiness. They are the sedatives. Tranquilizers. So you see, in generally clinical practice or the clinicians, they interchange these two words. They call sedative tranquilizers, right? Which is technically incorrect, but they are still using, and you can also find the same thing in the textbooks. So it's still acceptable. But technically, scientifically, their definition is different. Because sedative, they reduce the mental activity and cause sleepiness, whereas tranquilizer, they reduce anxiety and they does not decrease awareness and wakefulness, right? That means if you give tranquilizer to an animal, he will be calm, but if you will touch or stimulate, he will be awake, just like a normal. It's just a calming effect. But the sedatives, on the other hand, they really depress the central nervous system and they reduce the mental activity. Okay. Okay, moving forward. So why do we use these sedatives and tranquilizers? To calm patients and allow easy handling. Okay. To calm patient and allow easy handling. Those patients which are very ferocious, right? And for smooth induction, okay, this is very important point, because during induction we'll go further I will not go in more detailed points because it will confuse you. During induction, remember, there is excitement stage in anesthesia where there's an increased release of epinephrine, right, which can cause cardiac arrhythmia and cardiac arrest. So for smooth induction, okay, we also can use in those animals which are stressed, right, due to handling or due to new environment. Okay, so we use sedatives and tranquilizers to calm them for smooth induction, and also that will help in smooth recovery. Okay, so most common classes of these drugs which we are using, they are phenothiazines, benzodiazepines, sedative and tranquilizers, and alpha and agonists, alpha 2 agonists, and then opiates. These are the most commonly used sedatives and tranquilizers in veterinary medicine. So let's go to the phenothiazines. Go back, previous slide. Yeah, so most commonly used phenothiazines, we are using aspromazine. There are others, chlorpromazine and triflupromazine, but the most commonly, which we also use in our clinic, is aspromazine. Okay, how it works? All right. How the phenothiazines effect they work? Their site of action is reticular activating system, right? And what are its characteristic? It causes sedation, so it is sedative also. It has anti-emetic effect. It prevents vomiting, and so that means you can also use in the animals which come with a complaint of vomiting, and you want to uh, induce them or anesthetize them for any surgical procedure. You can use phenothiazine, right? Aspromazine, the most common use, and it has also anti-arrhythmic effect, right? So it is very helpful for the calming the patient to prevent the arrhythmia of the heart. And also it has antihistaminic effect, which is also very good for the animal, right? Sometimes in the panic or new environment animal, and sometimes the drugs, like just an example I'm giving you, sometimes in some animals we use the drugs which they can also cause reaction to them, like its release of histamine. So this is antihistamine. So another thing that we cannot use uh, in the disease of liver, and right, not recommended in liver dysfunction, because it will then prolong, because it's metabolized in the liver, right? And then after metabolizing the liver, it goes to kidney. So if the liver is damaged, the function is not proper, the drug will remain in the body, it will not be metabolized, so the effect will be longer, right? So in those cases we cannot use phenothiazine. It causes peripheral vasodilation. So as a result, it decreased temperature, decreased blood pressure, but increased heart rate. The heart rate is increasing because the blood pressure is decreasing. So the body wants to compensate, okay, by pushing more blood. That's why heart rate increases. And in horses, it causes penile prolapses. So horses, those practitioners who are working on horses, they have to be very careful with this drug. Most important thing that phenothiazine, this has no analgesic effect, no pain killing effect. Okay, so we move forward. Okay, this is the dose of the drugs. This is, you can also go and find other references. This is just for your reference, that phenothiazine dose and route in the dogs and cats. Okay. Oh. Okay, so another class is benzodiazepines. You have heard of Valium, diazepam, midazolam, zolazepam, lorazepam. These are the most commonly names which you will come across in the textbooks. But the most common, there are the two drugs which are being used in I will say in our clinic. Maybe others, they have others also. We are using diazepam and midazolam. Most commonly, we have diazepam and midazolam. Okay. How they work? Okay, their side of action. So you remember why I recap GABA. So their side of action is GABA, gamma aminobutyric acid. And what are they? Who will tell me? I need to listen you. What is GABA? Anybody?
Gamma aminobutyric acid.
Hmm?
Gamma aminobutyric acid.
Okay, yes, but what is that?
Neurotransmitter.
Okay,
Inhibitory.
what is it? Okay, yeah,
Neurotransmitter.
correct. Inhibitory neurotransmitter. That's great. So now you will understand how it acts actually, and what is the role of GABA. So side of action of this drug benzodiazepine is GABA. So when it acts on the GABA, that means it inhibits the information or the processing of information. Okay, so it other effects, they are anti-anxiety and calming effect, right? So when the animal is anxious or ferocious or angry or stressed, that means what neurotransmitter is in action? Excitatory, correct? So that is the glutamate. So when we give benzodiazepine to that animal, so that will act on the GABA, and then GABA receptors of that neurotransmitter, and that neuron will release the GABA neurotransmitter at the presynaptic vesicles, and that will go in attach in the receptor in the postsynaptic neuron. So what it will do, it will inhibit the processing of information, so everything will be slow or stop. So that is anti-anxiety and calming effect. You get my point? And then of course everything will go slow, muscle relaxation, anticonvulsant if animal is having seizures. So when you give this drug effect on GABA receptor, seizure will stop. It is anticonvulsant. And the good thing is that this has no effect on the cardiovascular system, which is very important, because during anesthesia, our goal will be to maintain the cardiac output, right? And also this drug has no effect on the respiratory effect. So we have also to maintain the breathing, respiration, right? For the gaseous exchange. And again, because this is metabolized in the liver, so it's not recommended in the liver dysfunction. And also this drug stimulates appetite. It can also cross placental barrier. And again, like phenothiazine, this has no analgesic effect. Okay, so this is the just a dose for benzodiazepines in the cats and dogs. Okay. All right, so another class we have alpha 2 agonists. So under this class, we have, of course, many drugs which are new, like medetomidine, detomidine, romifidine, but the most commonly which is used and which is also used in our clinics is xylazine, alpha 2 agonists. They are very potent sedatives. Okay, go ahead. So how they work? Alpha 2 side of action is alpha 2 adrenoceptors on sympathetic nerves within the brain and the spinal cord. So activation of alpha 2 adrenoceptors causes decrease in norepinephrine. Like you see, norepinephrine is also another neurotransmitter. Okay, and what it causes norepinephrine and epinephrine. You know, adrenaline and noradrenaline, when they are released, they cause increase in heart rate, right? And cause vasoconstriction, increase in the blood pressure. So you see again what is the effect of this drug. That will also similar to that of the that previous benzodiazepines. So when it causes activation of alpha 2 adrenoreceptors like norepinephrine, it will decrease norepinephrine. The results will be sedation, analgesia, and muscle relaxation. Okay. Okay. Other effects. They are very potent sedatives. Potent mean if you give the drug to animal, the animal really will go down. It will sleep. You cannot awaken until the effect of drug is over. Muscle relaxation. The good thing in that is they are painkillers. They are very good analgesics, but they have also their side effects. Vasodilation. When they cause vasodilation, they decrease the heart rate and decrease the blood pressure. They also depress the respiration. They cause vomiting also. And like xylazine, when you give xylazine to the cats or the dogs, once the effect starts, they will start vomiting. And they depress the GIT activity. In ruminants, they will cause tympany and bloat because they decrease. Because ruminants, they accumulate a lot of gases. So they are to be used very carefully in ruminants. And they are more potent in ruminants. Hyperglycemia and urination, they also cause hyperglycemia, urination. And then they can cause abortion in cattle, increase intrauterine pressure. Okay, and these are the drug. This is the dose of the most commonly used drugs. Medetomidine, we don't have in our clinic, and we have most commonly we have xylazine. Moving forward, opioids. Opioids are the non-cures. They are the derived from morphine. Opium, you have you have heard of opium. You might have read in pharmacology. Opium. So this is the source of opioids. So they are derived from morphine, and they induce physical dependence and addiction also. They the drug abuse. This is that one. Actually, opioids are a very versatile class of the drugs. They can be used as a pre-anesthetic. They can be used as a co-induction for inducing animal. They are very good analgesics, and they are very good sedatives. So they cover all these aspects. So most commonly used opioids. Let's go to the next slide. Which are used throughout the world are morphine, fentanyl, mepridine or pethidine, buprenorphine, oxymorphone, and butorphanol. In our clinic, we have morphine, we have fentanyl, and we have pethidine. Okay, how they work? How do they act? Go forward. So there are the 4 types of opioid receptors, which are the site of action for the opioids found on the neurons throughout the body. There are mu, kappa, sigma, and delta. Okay, moving forward, we divide the drugs according to the receptors. So mu receptors, they are morphine, for example, mepridine, fentanyl, oxymorphone, and buprenorphine. They are mu receptors. I mean, they actually act on mu receptors and also kappa receptors. And morphine also can work on sigma and delta. Morphine, fentanyl, and mepridine, the 3 ones. So they are very potent, very, very potent. When you go into clinical practice, you have to be very careful using these drugs, keeping in many things you're considering while physical examination. They cause respiratory depression. They cause euphoria, I mean excitement. In case when there is no pain, dogs and kids can also show excitement, right? And they also can cause addiction. Very good analgesics. So most commonly, the primary and the major goal of using these opioids is actually analgesia, the pain management. They are very good sedatives. Okay, these are the most and major important things in the effects. I mean, and they also called the meiosis. Okay, moving forward. Okay, effects and uses. So we already discussed, but okay, let's have a briefly go through the slides. They depress respiration. So when they depress respiration, important from anesthetic point of view. So when they depress respiration, they will decrease oxygen, right? And they increase the carbon dioxide, right? When they increase the carbon dioxide, what will happen? Increase the blood pressure. Okay, I'm not going into detail. Just stop here. They decrease oxygen, so they increase the carbon dioxide. Later we go when the carbon dioxide increase, what happens? GIT, effect on GIT. They cause diarrhea, they cause vomiting, they cause flatulence while increasing the peristalsis. Addiction, of course, is a prolonged use, which we are not using here. Vasodilation, of course, they will affect on the vessels. They dilate the vessels, causing the pooling of the blood, resulting in decrease in the heart rate, blood pressure. They cause meiosis in dogs, mydriasis in cat, and they cause increased salivation. These all effects, they come when they effect on their different receptors. mu, kappa at different parts of the body. So most dogs effect within 60. In most of the dogs, when you inject the drug, IV effect starts immediately within 60 seconds and 15 minutes after intramuscular. And duration of action 5 to 6 hours. For example, for morphine, if you give morphine, that will cover 5 to 6 hours, sometimes to 8 hours, but generally you'll find the text is 5 to 6 hours. For fentanyl, is very short, acting only 30 minutes. We give IV. Mepridine or pethidine, the general is 2, but sometimes can go to 3 to 4, right? So that's how their duration of action. Okay. Again, when we discuss, they are very versatile class of the drugs. So uses, they can be used pre-anesthetic, that means before induction of anesthesia, is for the pain management, analgesia, sedation, and then neuroleptalgia. Okay, so this is some of the doses uh, of the opioids. You can also find different dosages depending on the condition and animals. You can reduce the dose according to the animal condition. And when you use other drugs, for example, when you are using morphine and then propofol together, or morphine and other drugs together, which also depresses CNS, then of course you have to be considering the other factors, right? So this is just a general the dosage. So dosage reduction and reducing, this is the general range. I mean, you can have it according to clinician's experience and depending on the animal's status, right? And the protocol being used on that animal. Okay. All right. So this is the last part of our lecture, neuroleptalgia. So neuroleptalgia actually is a combination of opiates and tranquilizers. Right. We already have tranquilizer like phenothiazine and uh, benzodiazepines. Okay. So combination of opiates. Just now we have morphine, fentanyl, pethidine, and few others. So these are the opiates, and then tranquilizers to achieve what are the main effects: calmness, okay, sedation, and analgesia. So of course analgesia and then other things. So it will help suppression the motor activity, so that will the muscle relaxation, suppression of autonomic enormous reflexes. So you can also do minor superficial surgeries like skin suture. You can do ultrasonography, right? But actually they don't produce uh, unconsciousness, which is not the true unconsciousness like other anesthetic drugs. Okay. Okay, moving forward. So most common combinations, this is immobilan, LA is a long thing, which is commercially available. It contains espromazine and etorphine. Okay, and it's used in dogs only. Okay, others are immobilan SA is a methotrexate and etorphine. Hypnom is another one. These are the commercially available. Okay, and fluonisone and fentanyl and Innovar or thalamonal is a droperidol plus fentanyl. These are the drugs which are we have not mentioned here. They are the commercially available. The drugs which I have mentioned, they are the most commonly you will find in the textbooks and the commonly available in various clinics. Okay, they can be more synthetic because new technology, new drugs, so could be more synthetic. So this is commercially available, but apart from that, you can also make your own combination in clinics, okay, with the available drugs. Moving forward, so these are another commonly used drugs. For example, if you have your own clinics, you can also combine these drugs like morphine, and mepridine, butafonol, hydromorphone, xylazine, and tranquilizers used are aspromazine, diazepam, medetomidine. Example: xylazine, pethidine, or aspromazine and morphine. That's how you can also combine the drugs. Okay, which are compatible. And this is some drug dose, and then you see when I say they are not true, they don't produce true unconsciousness. That's why this chart will show you that maintenance is always with inhalant. Sometimes you can do also with other supplemental of these drugs. You can maintain with injectables also, but this is just a basic understanding. So like combination of midazolam, diazepam with a hydromorphone or with a methadone, okay, and then drugs have been given, midazolam, fentanyl, okay. In that is okay. In midazolam, diazepam, you can inject in alternate increments, like give midazolam first, right, and then give hydromorphone or methadone, right, and wait until desired effects. You can give intubation and give opiate first, wait few minutes, right, then administer the benzodiazepine. And do not mix in the same syringe. The word I used, compatibility. So not all the drugs are compatible. You cannot do like we can combine xylazine and ketamine in one syringe, right? We can combine, for example, ketamine and lidocaine in one syringe, right? But there are some drugs which if you combine, they will cause reaction and there will be no efficacy or they will antagonize itself. So do not mix in the one syringe. This combination, midazolam and hydromorphone or methadone. Another combination is midazolam fentanyl, right? And again, give opiate first, wait few minutes, then administer benzodiazepine. Do not mix in the same syringe again. But midazolam and fentanyl can be mixed in one syringe because of that. I'm saying this, or the comments are there because they are based on their chemistry of the drugs, right? Chemical formula. According to them, they are compatible with some drugs, and some are not compatible. This depending on their basic chemistry. Because we are not chemists, so we will not discuss that. Okay, so this is the some combinations. Okay, so midazolam or these benzodiazepines, yeah, especially midazolam, you can reverse with flumazenil. Xylazine, you can reverse with antidote, which is yohimbine. Okay, and then also opiates. There's a naloxone, which is the antidote. I mean, if you give opiate and you see the side effects are very severe, you want to reverse the drug's effect, you give naloxone and the drip, like for example, you give morphine and the blood pressure of that animal will go down. You are really scared. You give naloxone, the blood pressure will come to normal. So they are called antidotes. Okay, same like yohimbine, which reverses xylazine effect, and midazolam, which can be reversed by flumazenil. Okay, all right. Go forward. Do we have something? Okay, I think that's all. That's all our lecture today. This will be our next lecture probably. So I hope you. I hope I have tried and explained in a very in a way that you had understood. Hopefully. Okay, now we can discuss, or if you have a question, you can also start. Any question?
Doctor,
Mm-hmm.
what does it mean by not true unconsciousness?
Which one? Say again.
What does it mean by not true unconsciousness?
Okay, true unconsciousness means, for example, when we are using really real anesthetics, like right, the anesthetics, which they which we can start a major surgery. Like in these drugs, true unconscious means the animal is not really unconscious, but it's kind of a deep sedation, very deep sedation, or kind of a like sleepiness, right? It's not a kind of state of anesthesia, right? You cannot do a major surgery or painful surgery or more invasive surgery. You understand that?
Yep. Thank you, doctor.
Okay. Any other question? Okay. Any other question?
Doctor.
Hmm?
So how to administer the drug? Macam mana nak tahu nak guna IM or subcut ke?
Which one? Which drug?
Um, for example, like opioid, like morphine we can administer through IM or subcut, right? So
Yes.
macam mana nak
Which
tahu like
morphine we can administer intramuscular, we can administer IV, and we can administer subcut. But remember, IV administration is not recommended because it causes a release of histamine, and that will lead to a really, really very bad decrease in the blood pressure and decrease in the heart rate, and then you have really to struggle. I mean, when you are doing anesthesia and you give during anesthesia, for example, animal is under pain, you want to give control the pain or address the pain. If you give morphine intravenous, then you will be putting yourself in stress because that animal will really struggle. It causes release of histamine, so it is not recommended to give intravenous, especially during the when animal is under anesthesia. Not at all. I will not recommend. Is this your question, or is something which still remains?
yes.
Okay, so you got the answer, is it?
Yeah.
Okay.
But for IM and subcut we can just choose either two.
Yeah.
I
Can be given intramuscular. Either give intramuscular or give subcut.
but the effect is the same for the duration is the same
Yes,
ke
yes.
lain?
Yes. There will be no difference in the duration and effect.
Okay.
Yeah.
Thank you, doctor.
All right. Okay. Any other question?
Doctor,
No. Yes.
there are some drugs that are not recommended in liver dysfunction, right?
Mm-hmm.
So if patients with liver dysfunction, what option that we can use for?
Uh, okay. Say again. Rephrase or repeat your question. There are some drugs which are not used in the liver function. You say like that, right?
Yeah.
Okay. Then more.
So if the patient has like the liver is has liver disease or anything,
Mm-hmm.
what drugs can we use?
Okay.
Uh,
In that case, there are the drugs which, for example, which do not whose metabolism is not major. I mean, the major part. They don't use the root of liver for their metabolism. Like for example, or the drugs which are short acting, we can use that. Like if you ask me from that point of view, for example, if the animal is in having the liver problem, and if I want to induce, for example, propofol is a very short acting, right? it effect will not have an effect on the recovery, right? There will be no prolonged recovery. In that case, you can use that one propofol, for example, which is very short acting, and there are other drugs, other example like in inhalant anesthesia, they are not metabolized through the liver. So the drugs which are not metabolized through the liver, we will go for those options, or the short acting drugs. I mean, you have to choose a protocol which is safe for the animal. It should not have any side effect on the animal. You have to maintain the animal's status within the normal limits, and that would not have a effect on the recovery period. Yeah, you want to bring animal in from anesthesia to recovery very quickly, right? There's a major goal of I mean anesthesia and post and the recovery. So of course you will not go for the drugs which use which their major part is metabolized through liver.
All right, doctor. Thank you.
Okay. 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 No more questions, class rep.
No more, doctor.
Okay. Class rep. Normally, how you give your attendance?
Usually I take the attendance, doctor.
So you will take attendance for this class, right?
Yes, doctor.
So total students participating today are 109, is it? Or maybe
Yes.
108 because I am the 109.
I
Okay. Okay, later you provide me attendance. Huh?
okay.
So no more question. That's all. Maybe I will upload this class rep. The email, the slides which I have given you is a combination of all the things, right? So that's not the lecture for this. I mean, I have a separate lecture. Maybe I will upload on the Putra Blast. Maybe after this I will upload on the Putra Blast and text you. Okay.
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 Thank you very much. Have a very good day.
Thank you so
Thank you,
much.
doctor.
Doctor.
Thank you, doctor.
All right.
Thank you.